Welcome to this week's Health and Care update on the coronavirus pandemic in Devon. As a result of the vast majority of people sticking to the national lockdown restrictions, we are starting to see a plateauing of the cases. I'd like to hand over now to my colleague Simon Chant, who'll go into more of the detail about the data.
This is an overview of the latest national and local data on COVID-19 as of Thursday, the 21st of January. We start with the national picture. Cases have stabilised and are beginning to fall. The number of tests conducted has continued to grow as local testing capacity increases. Nationally, there's been a 14% increase in the number of deaths over the last week. Now for the local picture. In Devon, for the latest available week, there were 1,517 COVID-19 cases and 35 deaths, with rates of both below the national average. Case rates are slightly higher in Exeter and Teignbridge. Cases of COVID-19 have stabilised in Devon over the last week. Case rates are currently higher for those aged 20 to 59 and those aged 80 and over, but have stabilised for all age groups. The data in the summary is drawn from Devon's COVID-19 dashboard and the National Coronavirus Tracker, where the latest available information can be found.
Thanks, Simon. So while we're seeing numbers stabilising, rates are still relatively high, and it won't take much for those cases to rise again. So please stay at home, only go out if it's absolutely essential. And remember, if you do go out, social distance, wear your face coverings indoors and wash your hands regularly. I'd like to hand over now to Dr. Paul Johnson from NHS Devon's Clinical Commissioning Group.
Despite our efforts to keep COVID-19 cases low in Devon, they are now at the highest level we have seen since the start of the pandemic, and they're continuing to rise. Hospitals across the southwest are also continuing to see increases in the number of people requiring hospital care. So it's really important to stay home where you can and follow government guidance to reduce the spread of the virus. The vaccine is being delivered, and thanks to the outstanding support of local people and staff across Devon, we're making significant progress towards beating this virus. Every one of Devon's 123 GP practices is now offering the coronavirus vaccine to eligible patients from 20 centres across the county. Residents and staff in care homes are being vaccinated through GP-led facilities, while our 4 main hospitals are also holding clinics and vaccinating people. We're developing a number of other measures, including mobile teams who are able to bring the vaccination closer to people in places where their local vaccination centre makes it difficult for people to access. The first community pharmacy in Devon began offering vaccinations this week at Westwood Hoe, and more will follow shortly. And more large-scale vaccination sites have also opened across the country, and we have plans underway for them to be opening in Devon. In the meantime, if you are one of the top 4 priority groups, you may receive a letter from the National NHS Vaccination Booking Service inviting you to book an appointment at the Regional Vaccination Centre. Currently, the closest is in Taunton. If you can travel to that centre safely, then we recommend that you book using the details in the letter. Alternatively, you will still be eligible for one of the 20 GP-led centres, which will be likely closer to home. When attending that vaccination appointment, please don't be early, but if you do turn up early, just wait in your car until the appointment time. And once you've had your vaccine, continue to follow the government guidance on social distancing and wearing a mask, as immunity takes weeks to develop. You have a vital role in helping the NHS vaccinate people as quickly as possible. So stay home and follow the government guidance. Choose the right service for your needs, such as 111 or your local pharmacy or self-care. If you'd offered a vaccination appointment, please do all you reasonably can to attend. And don't contact the NHS about getting a vaccine. We will contact you.